Welcome to DermWIre News, powered by DermWIre.com. DermWIre News for Smart Speaker is made possible with advertising support from Ortho Dermatologics. I'm Stephanie Talea with Practical Dermatology magazine. Top-line results from the pivotal trial of Sienna Biopharmaceuticals SNA-001 show that the topical agent, in conjunction with an 810 nanometer diode laser, was statistically superior compared to vehicle plus laser. In the study involving 65 male and female patients with white, gray, blonde, light red, and light brown hair, SNA-001 demonstrated up to a 31% reduction of light hair from baseline. The data show that SNA-001 met the primary endpoint of non-inferiority in hair reduction, negative 17.5% with the SNA-001 plus laser, compared to negative 1.1% with vehicle plus laser following 6 treatment sessions. People with white, gray, blonde, and red hair, for whom lasers are ineffective, have been limited to using waxing and razors to remove their unwanted light hair, which yield temporary results, and in the case of waxing can be costly to maintain. Market data indicate that a safe and effective treatment for people with light hair could increase the number of laser hair removal procedures by 27% in the United States. This represents the first major breakthrough in laser hair removal in over a decade. Sienna's silver photoparticle technology, combined with the lasers we already have in our offices, showed a meaningful reduction in light hair, something we've never achieved before, said Dr. Matthew Avram, Director, Massachusetts General Hospital Laser, Cosmetics, and Dermatology Surgery Associate Professor, Harvard Medical School. If cleared by FDA, SNA-001 would allow physicians and aesthetic centers to expand their current practices by bringing in new patients with blonde, gray, white, light brown, or light red hair who have resorted to waxing and shaving. Once available, I would anticipate rapid and widespread adoption of SNA-001. SNA-001 was evaluated in conjunction with a 1064 nanometer ND YAG and 755 nanometer Alexandrite laser for the reduction of light hair, showing a significant reduction from baseline and providing a potential path to regulatory clearance. These results, however, were less differentiated from the vehicle plus laser group compared to the 810 nanometer diode laser study results. A third and final pivotal trial of SNA-001 in acne was also completed, demonstrating SNA-001 was non-inferior to laser therapy and providing a potential path to regulatory clearance. Superficial radiation therapy, or SRT, should be first-line therapy for appropriate non-melanoma skin cancers in appropriate patients, according to a new consensus guidelines published in the Journal of Clinical and Aesthetic Dermatology. Appropriate tumor types for SRT include primary basal cell carcinoma and squamous cell carcinoma, significant SCC in situ, and certain cases of cutaneous lymphomas and Kaposi sarcoma, the guidelines state. In addition, a consensus was reached on various other aspects of SRT use, including suitable anatomical areas, energy, fractions, and scheduling recommendations for SRT. Safety factors, as well as treatment recommendations for keloid scars, based on the literature and on both the opinions of the expert group and a survey of experienced users. It is vital that the medical community has clear, concise, published treatment guidelines based on a thorough review of all literature and expert opinion on SRT to date, says Dr. Mark S. Nestor, Director, Center for Clinical and Cosmetic Research at Ventura, Florida, and voluntary professor, the Department of Dermatology and Cutaneous Surgery and Department of Surgery, Division of Plastic Surgery, at University of Miami Miller School of Medicine, and the lead author of the guidelines. Our goal in forming these guidelines is to fill an important knowledge gap regarding the use of SRT and demonstrate its overarching efficacy with various patient populations across the globe. Thank you for listening to DermWIre News, powered by DermWIre.com. This editorially independent program is supported with advertising from Ortho Dermatologics.